I'm Dr. Michael Pippin. I'm a board-certified gynecologist. We're going to talk about gynecologic cancer, which is a pretty broad topic, but we're going to limit ourselves to talking about cervical cancer. The people at risk are mainly people who've been exposed to a so-called high-risk type of human papilloma virus. So this is a unique situation in which an infectious agent is actually the cause of cervical cancer in most instances. Cervical cancer is caused primarily by high-risk human papilloma virus. This is something that's usually acquired by sexual transmission, and I don't want to imply that if you get human papilloma virus, you're going to have cervical cancer, because in most cases, people who get HPV, it resolves, it goes away by the body's immune defense system, and it doesn't cause you further harm. But in those individuals that have HPV and persists for a long period of time, those are the individuals most likely to get cervical cancer. So getting an immunization early on in life for HPV is extremely important. We know that this can reduce the risk of cervical cancer and precancerous conditions of the cervix greatly. We also know that getting screened regularly and following the guidelines for screening is very important, because that'll prevent cervical cancer from developing. And finally, we know that smoking is a cofactor for development of cervical cancer, meaning it doesn't necessarily cause cervical cancer, but if you have HPV and you're a smoker, it increases your risk greatly of that progressing to cervical cancer. We have some great ways to reduce it. Just having regular Pap tests and screenings for HPV will reduce the risk of cervical cancer, because cervical cancer develops slowly, and if you identify those precancerous situations, you can treat them before they become cancer. That's one way. Probably the single most important way is for the youngest of our patients to receive the human papilloma virus vaccine. The HPV vaccine will not prevent every single case of cervical cancer, but we know it has the potential to reduce the incidence of cervical cancer and precancerous situations very dramatically. So I would encourage all moms who have daughters especially to get their daughters vaccinated, because all women can be at risk and they can't predict if they're going to be exposed to HPV or not. For invasive cervical cancer, at its earliest stages, it's a surgical disease. So it's treated with hysterectomy and lymph node dissection. If you have a very advanced cervical cancer, they're only treated with radiation therapy, and if cancer is beyond the pelvis, it's treated with chemotherapy and radiation therapy. The important thing to know is most cervical cancer is not invasive cancer, but rather precancerous conditions called dysplasia, and that can be treated by simple methods, even outpatient surgical excision with minimal downtime. And the important thing is to get yourself diagnosed before it becomes invasive cancer, and you get that done by just having regular checkups and your Pap and HPV screen. I think the important take-home messages here are for the younger people, and we're talking about teen and kind of preteen. Their parents should be aware that there is a human papilloma virus vaccine, that the vaccine will prevent cervical cancer and precancerous conditions of the cervix, and that it's important that they consider this as part of the immunizations for everything, just like prevention of measles, mumps, rubella, or COVID. The immunization for HPV can prevent a particular type of cancer. which is a unique situation. For women in general, I think they should be aware that getting regular screenings, and that includes both PAP and HPV testing for the appropriate age group, is important because that's the best way to prevent the development of cancer or diagnose a precancerous condition early on in its course. Plus the other benefits, general health benefits of getting screenings.